Hello, and welcome. Today we'll be exploring a relatively uncommon, yet potentially serious heart condition, sinus of Valsalva aneurysm, or SVA. We'll delve into what it is, how it develops, its impact on the heart, and the available treatment options. The exact cause of sinus of Valsalva aneurysm isn't always clear, but it is primarily congenital, meaning individuals are born with a weakness in the wall of the aortic sinus. This weakness can be due to a deficiency of elastic tissue or other structural abnormalities. Acquired causes are less frequent but include infections like bacterial endocarditis, trauma, connective tissue disorders such as Marfan syndrome and Ehlers-Danlos syndrome, syphilis, or even complications following cardiac surgery. Pathophysiologically, a sinus of Valsalva aneurysm involves the dilation or bulging of one or more of the three sinuses of Valsalva. These sinuses are located at the base of the aorta, just above the aortic valve. As the aneurysm grows, it can press on adjacent structures, such as the heart chambers, coronary arteries, or the pulmonary artery. This pressure can lead to various complications. The most significant complication occurs when the aneurysm ruptures. A ruptured SV often breaks in the right ventricle, right atrium, or less commonly, the left atrium. This sudden communication creates a shunt, where blood flows abnormally from the aorta to the receiving chamber, increasing the workload on the heart and leading to heart failure. Sinus of Valsalva aneurysms are relatively rare. Estimates suggest they account for only a small percentage of all congenital heart defects, typically less than 1%. They are more commonly seen in individuals of Asian descent, particularly those of East Asian origin. Men are also affected more frequently than women, with a ratio of approximately 4:1. Many individuals with a sinus of Valsalva aneurysm remain asymptomatic for years, especially if the aneurysm is small and unruptured. Symptoms typically arise when the aneurysm enlarges or ruptures. Common symptoms may include chest pain, shortness of breath, a noticeable heart murmur, palpitations, and fatigue. In cases of rupture, patients may experience sudden, severe chest pain, a sensation of something giving way in their chest, and rapidly developing heart failure with severe shortness of breath and swelling in the legs and abdomen. Diagnosing a sinus of Valsalva aneurysm usually involves a combination of clinical evaluation and imaging studies. A doctor may suspect the condition based on a characteristic heart murmur heard during a physical examination. An echocardiogram, both transthoracic and transesophageal, is a primary diagnostic tool, providing detailed images of the heart and aorta. Cardiac MRI and CT scans offer further anatomical detail and can help assess the size and location of the aneurysm. Cardiac catheterization may be used in some cases to evaluate the coronary arteries and measure pressures within the heart chambers. Sinus of Valsalva aneurysms are often classified based on their location: right coronary sinus aneurysms, non-coronary sinus aneurysms, and left coronary sinus aneurysms. They can also be categorized as ruptured or unruptured. Aneurysms can be further classified based on their morphology as shape and size, and their relationship to adjacent cardiac structures. The management of sinus of Valsalva aneurysm depends on the size of the aneurysm, the presence of symptoms, and whether or not it has ruptured. Asymptomatic small aneurysms may be managed conservatively with regular monitoring. However, symptomatic aneurysms, or those that have ruptured, require surgical repair. The surgical approach involves closing the aneurysm and repairing any associated defects. This can be done through an open heart surgery approach via median sternotomy. Minimally invasive approaches are also being developed and used. Post-operative care includes monitoring for complications such as infection, bleeding, and arrhythmias. Long-term follow-up is essential to ensure the repair remains stable and to assess for any recurrence. Currently, there are no definitive preventative measures for congenital sinus of Valsalva aneurysms. However, managing risk factors for acquired causes, such as prompt treatment of infections like endocarditis and careful monitoring of individuals with connective tissue disorders, can potentially reduce the risk of developing an aneurysm. The prognosis for sinus of Valsalva aneurysm is generally good with timely diagnosis and surgical intervention. Without treatment, ruptured aneurysms can lead to significant morbidity and mortality due to heart failure and other complications. Ongoing research focuses on improving surgical techniques, developing less invasive approaches, and gaining a better understanding of the genetic factors that contribute to the development of these aneurysms. Advances in imaging technology are also aiding in earlier and more accurate diagnosis.